Hello, everybody. Good morning. Chapter 20. Today we are starting Caring for the Young. Supporting the child, infant, and teen. So, as a personal support worker, we have to be mindful about certain qualities, the age related difficulties, the physical complications of infant, child, or teen. And we have to make sure that whatever mentioned in the care plan, whatever the family member talk about, the special qualities, the focus we have to put on the child, infant, or teen, we have to do it. Support workers are expected to provide care and support to the people of all ages, including the young. We are age blind, we are gender blind. We have to give care no matter what age the person belongs to, and what gender, what ethnic, cultural, linguistic, or communal background the person has. Since we have the assignment to work as a support worker, we have to do it. So, at this point, we must remember that children have the rights too. Now, we are supporting the children, and they have the rights like the adult people have, like the elderly people have, different rights in the long-term care homes. And we must remember to follow the principle of DIPS, which means dignity, which means the prestige they deserve, the dignity, the value of their life, independence. We have to always focus that naturally all people want to be independent. Nobody wants to depend on others. And our prime focus will be how to encourage them to be independent, how to encourage the children to be independent. They have the choice and preferences. Our focus should be what they choose to eat, to wear, where they want to go for playing, what playing doll or playing stuff they love, and they want to keep it most of the time, what color of the play items they like. These are the general preferences of the children we have to focus. And privacy. Privacy is important for everybody. This is a privacy which we have to maintain while giving them shower, taking them to the washroom for the bowel movement or bladder movement. And safety is always the prime concern, no matter whom we work with, where we work. And especially in the case of children, safety and injuries are very, very correlated things. We have to focus on that. Therefore, you have to know these DIPS, dignity, independence, preference, privacy, and safety in your fingertips just before you starting your shift. Till the last minute you work with them. You have to focus with them. Support worker, of course, have the responsibilities. These responsibilities they learn, they follow. This is also called the scope of practice. This is also called the assignment. They are assigned to do certain responsibilities. Your role is to provide a stable, secure, and safe atmosphere for the family. Safe, stable, secure, and safe atmosphere for the family. How do you do it? In the family, what is going on in the family? You have to report to the supervisor. Develop positive relationship with all the family members. This is a principle. You have to develop positive relationship with all the family members. What kind of positive relationship? This is called a kind of professional relationship with the family member. and therapeutic relationship with the client you are working with. Similarly, maintain the existing rules of behavior. Every home, every household, they have their own rules and behavior. The rules where they put hang their winter coat, they off the keep the shoes, how they speak, what time they prepare meal. Like there are so many general rules in the family. When you go to that family, you have to comply with that. You have to follow that. Maintain daily routines. What are the daily routines? You are working with the child and you work in that house of the child where there are other family members also. How you maintain the daily routine? This is a routine of your client, of the child you follow. You do not follow the whole everything of the family, which is not your business. Your business is you are assigned to the child as your client, and you have to maintain what is the daily routine of your assigned person. What time you wake them up, what time you give them shower, give them breakfast, give them warm milk or cereals or lunch or dinner or snacks, whatever. All the daily routines. Take them to the shower room. What else? Sometime they may have a reading time, they may have a play time. So the general daily routine, the general rules of the daily routine, every support worker is expected to follow in a family. Be alert to the situation that may create stress or cause harm to the family. You can sense, you can figure out what's going on in the family. Is there anything unusual going on? Page number 361 gives all the necessary points. You have to be careful about that. Maybe sometime you have to report to the supervisor. Let's go to page number 361. What are the safety? These are basically the safety box. The safety is all about the violent behavior of a family member, frequent visit by stranger. Do stranger visit the family frequently? What behavior, what pattern of behavior, what kind of language they use? Are they relatives or friends or who they are? There may be some kind of suspected drug abuse, alcohol abuse going on, maybe some kind of unusual behavior going on. There may be electricity turn off, water or heater turn off. There may be something you sense some risk, potential risk in the family after the arrival of the people in the house. Or is there shortage of the food and clothes? And what is the financially the people have organized, if they have the the weather suitable clothing or not? Did you find there was another caregiver? What um, was she suddenly departure, the working situation there? You can ask with the agency you work with, or you can talk to the supervisor or the nurse. Or is there any unexpected return of the family member? All these are about the safety. All these points may indicate certain safety concern which you have to be aware of. And you have to document and report to the supervisor. Meeting nutritional needs. Now we are going to how we can help, how we can assist the client, the child, to meet their nutritional need. Nutritional food is needed to grow and develop each body system to maximal potential. There are so many categories of the nutrition. adequate food, adequate water and fluid, the food that containing the carbohydrate, protein and fat, they have a different function of their own in the body for the maximal development and maximal potentiality of the body. There may be certain challenges to meet the nutritional need of the children, physical or developmental challenges. The child may have certain physical disability, cannot walk, cannot go to the kitchen and dining table for the food. We have to assist. Certain developmental challenges, maybe the child, the client has certain issue with the chewing food or swallowing. Maybe the child has the difficulty swallowing, which we call dysphagia in nursing. When the person has a difficulty swallowing, we have to feed. When we have to feed those child, we have to be very careful. Sometimes they do not swallow the food and collect the food in the one cheek, which is called food pocketing. That leads to choking. And you have to get so many information from the family members in this point. How the family members have been feeding the child. You follow their own pattern, which makes the child also easy and for you also very easy. And also focus on the family situation that may create a stressful working environment for the support worker. Family situation that may create a stressful working environment for the support worker. What does it mean? You never know. Maybe one of the family members is alcoholic and comes to the workplace, tries to abuse the child or try to abuse you as a support worker, sometime as yelling at the people, and sometime trying to physically abuse and verbally abuse. At this point, your job is to maintain the safety of the child and call the supervisor, call other family members who are more responsible to the child. And again, financial condition makes the nutritional needs different. If the children are living in the poverty, the child may not need enough food, nutritional food, and may be having the issue of the nutritional deficiency that leads the child to the malnutrition, or the child is eating only less and less food because of the financial condition. You have to report it. School age children alone, latchkey kids, school age children, they become latchkey kids. What does it mean? The word latchkey kids means the children who come home from school with empty stomach, or the kid who is supervised by the elder siblings at home, or the kid is left alone at home when their parents are going out for the work. So school age children at this condition, they may not be eating enough food, enough nutritional uh, supply. You have to also look after the obesity, the quality of food. High sugar and high fat diet leads to obesity. Obesity is unnecessary body mass index. That means they are very fat, chubby, which is more than necessary for them. It is also getting overweight every day, which we call obesity. We also have to report that child is eating high fat, high calories, and high sugar diet, high sodium diet. That's why they are getting overweight. which is obesity. Self-esteem. What the child thinks of himself or herself is the self-esteem. There must be positive self-esteem, positive high self-esteem. And we have to positively reinforce the kid to eat food. We have to encourage the parents and other people to bring the food they like. If they are positive towards the food, they can fulfill their nutritional needs. Otherwise, it is very difficult. And cultural diversity. Cultural diversity means everybody is born in a certain culture. We have our own culture. Maybe our client have a different culture. We have to respect others' culture. And this is a Canadian multicultural society. We have to know about their culture as well. We have to ask with the nurses, the supervisor, and the family member. And what is the culturally appropriate food item they practice, they eat at home, and they feed the child. We have to know about it. Now we are going to help a child eat well. So helping child eat well means we are assisting there, we are supporting there for everything. Families should try to eat meals together. If family member they eat meals together with the child, it assures all other family members that the child has eaten enough meal. Meal table is a precious time. Eating time, meal time is very, very important. It must be positively reinforced. It must be conflict free, and do not bring any difficult discussion, any issues for the child, of the child at the meal time. Make the child free of all other situation and only focus on eating. That helps child to eat well. Similarly, there is a there are so many distractions the children are using. While eating, the parents sometimes give them their cell phone, the TV is open, they use with the toys, and so many things. And the problem here is the children are more on those stuff and they are not focusing with the food they need to eat. That is why our prime duty must be give them zero distraction, positively reinforce them to eat, and there should be no conflict in eating. Try to minimize the conflict. A toddler, a 2 years old boy or girl, might be fighting in the dining table, but minimize it. To minimize it, know the concern of the child, actively listen the child, give the preferences, take help from the family, and so on. Proper table manners. So the respectful behavior. Manner is how you talk to other people, and you have to be very respectful in behavior. Means speak very soft tone of voice, call the person with the first name or how they prefer to be called. Ask with the child how you want to be called, or ask the family member, and be very, very respectful. Allow the children to make the choices. They self-correct their under or overeating. When you give them their choices, they will self-correct how much they eat or how much they don't have to eat. That's called overeating or undereating. It is very common issue with the children. Now, this is the time you have to be free of judgmental voice, and you have to reflect yourself, and you have to show empathy, adjusting your approach based upon child's age. When you are working with the school age kid, like 7 years old girl who has certain problem and doesn't go to the school, how you do it? We will discuss about it later. Now let's go to the infants. Up to 1 years, the small children or a child is infant, follow the internal hunger and fullness cues. An infant cries. If the infant feels hungry or thirsty, the infant cries. So these are the crying are the cues that they are thirsty or hungry. You have to give the child food. Eat when hungry and stop eating when full. Do not feed the child so much. Feed the child as much as necessary or as much the family has been feeding them, or ask with the family how much they have been feeding, they feed and they want to feed. And check the volume and the quality of food every time you feed them. If you find certain deficiency, you have to report to the supervisor. There may be certain negligence on giving food to the child. You have to be careful about that. Any kind of abuse is to be reported as soon as possible. And for the infant, feed on demand. Once again, the child has the hunger cues and fullness cues. Hunger cues, the child cries. Fullness cues, the child doesn't show any interest to the food. That means the child is full. Similarly, uh, we are going to from infant to child. After the toddler age of 3, the child goes to the the child goes to the childhood school age, or when turns to the 4, it becomes child from the toddler, infant, toddler, and child. These are the different age factor. And child age already aware of the food, the color, the taste, the texture, everything. Introduce a new food, encourage love of varieties, texture, and taste. The nursing literature says that the nutritional literature and nursing literature, they are interconnected. They say that the more item of food, the more varieties of food you introduce to a child, there is a less chance of getting food and food allergy and sensitivity in the adult life. So introduce new food, encourage the varieties of texture and taste. Normal to present Normal to present new or different food up to 15 times before the child is comfortable trying it. See, practice makes everybody perfect. Give them new food and different food up to 15 times before a child is comfortably trying it. Introduce them very comfortably in a safe environment. Introduce. Do not force them to eat. The more you force, the more they scare. Offer new food in a relaxed manner with no pressure for the child to try it, as if you are just introducing something else there. Let the child see the food, the color, the taste, smell the taste, or the texture of the food, which the child can see it. But do not force the child. That's the point. Similarly, here we are getting help for a child's eating habit. We have to be aware of what kind of eating habit the child has. If you are worried about the child's eating habit, talk with your supervisor. How the child eats, what times a day, or how many times a day, or what texture of the food. Does the child love to eat junk food or the food prepared at home? Like there are so many things you have to know as a personal support worker, as a caregiver, and you have to discuss about everything with the family member, the responsible family member, and the supervisor. Especially important if major changes in the appetite or weight. What is major changes in the appetite means? Maybe the child doesn't want to eat more. There is a certain changes in the food habit, or the certain changes may be more in volume or less in volume. The child doesn't want to eat anymore. The child used to eat frequently, but now the child is not does not show any interest on food, and the child is losing weight, or the child eats a lot of food now. All of the sudden, the change in the appetite, the habit of eating food, you have to report to the family or to the supervisor. Other concern, eating issue have turned mealtime into a battleground. What does it mean? Eating habit issue and mealtime, it is like a battleground. The child is fighting. The child doesn't want to eat, or the child wants the new item of food he loves. So at this point, we have to figure out what the child wants. That's the main issue. It is not important what we give to the child. It is more important what the child wants, because this child, as the school age child, has enough knowledge of his food preferences, and we have to also check about eating disorder, because eating disorder is very common in the children. The children, when they grow older, they jump into the teenage. Eating disorder is most common in the teenagers. Specific expertise, assistance from. So what is specific expertise means for you? It means how can you cooperate, coordinate with the different team members of healthcare team members to enhance the nutritional need of the child. You can take help from registered dietitians, pediatricians who are the doctors, therapists or counselors, psychiatrists. They will do another type of counseling and treat them by different meeting and counselings. Pediatric gastroenterologist, they talk about the GI system deficiencies, means when they eat the food, where is a problem in the GI tract, gastrointestinal tract. These are the specialist doctor, pediatric gastroenterologists. Again, there are pediatric endocrinologists. Endocrinologist, it's all about the endocrine system. It's about the hormonal changes in the body. Maybe certain hormonal, certain deficiencies of more hormone or less hormone that has caused other issues in the child's nutritional status. Protecting children from injury. Now, at this point, we are very, very concerned about always about the child's age, age-related activities, and their health risk. Injuries are the leading cause of death of children over 1 year of age. Accident, fall, choking, burn, abuse, poisoning, and other causes. Once again, remember, injuries are the leading cause of death for the children over 1 year of age. These are the we have to focus why the children, they between this school, the toddler and the infantile age, over 1 year of age means after 1 year they enter into the toddler's age, and why these children are getting those health hazards, we have to focus on that. So generally accident, they are the playing dolls. They all the time they go to the play, and sometimes they fall from the stairs, from the balcony, and they choke food. They do not know what size of the food they need to eat, and there may be burn or abuse. Abuse is one of the leading cause of the child injuries and death in Canada. Poisoning, they may eat anything. They may eat certain poisoning, the cleaning materials put in the home, and other causes. So your duty as a support worker is to prevent the child from those injuries. Support workers are responsible for ensuring that children, regardless of the age, are protected from the harm. These are the box 22 consumer product related injuries, page number 354, and box 23 risk factor childhood injuries, page number 355. So, box 22 consumer product related to injury, page number 354, talks about what are the potential hazards, the potential uh, consumer product related injuries. Like drowning and nearly drowning can occur in association with the bath seats, in particular when the child is left unattended. For example, you are giving shower to a child in a bathtub full of water. Do not leave the child unattended. Children playing around the dangling blind or curtain cords are exposed to a strange, strange regulation hazard. Certain areas where children are not allowed to go, sometimes they are there in the playful mood, and they just broke their hand or leg, or they just dangling on the blind spaces. They cannot see it properly, the blind spaces are there, and they have the injuries. So the furniture, television, and the large appliances like the fridge, refrigerators, they are also the common causes of injuries. Between 1990 and 2007, these items resulted in an average of 9,000 injuries cases per year, 71% of which involved children less than 5 years of age. So these are the consumer product related injuries. We have to protect the children from there. Similarly, the box 20.3 risk factor childhood injuries discusses about certain injuries like gender, temperament, stress, alcohol and drug use, history of previous injuries, developmental characteristics, cognitive characteristics, and there are so many other injuries. So here I encourage you to go to those boxes and read them thoroughly, which are very important for your exam and for your knowledge. Now in this area, excuse me, we are talking about the preventing falls in children. Fall is always a leading cause of injury to the children. Falls are the leading cause of injuries and leading cause of the death in children. Infants can roll off table, fall down the stairs, fall down from the balcony. Increase risk during the time of stress or changes in the family routine. So we have to be careful about stressful time. Always be aware of the possible changes. Please I refer you to go to these pages 356 and 357 that talks about how to prevent the falls and the ways to prevent the choking. Make sure that you know these points for your knowledge and for your examination point of view as well. Protecting children from burns. So, burn may be from the fire, from the acid, from other cleaning solution. Anything can burn the soft skin of children, and it is our prime duty to focus on their safety and prevent any kind of burn related injuries to the children. Hot liquids are often responsible for the childhood burns. For example, a parent could be drinking coffee, which is very hot, and the child unknowingly tries to take a couple of sips and burn the mouth. Therefore, it is our duty to prevent the children from any kind of burn and all the injuries related to the burn. So the box 358, it gives you detail about the how to protect the children from the burn. Please make sure that you are opening with your book and reading the slide together so that it can help you a lot for the understanding. Preventing poisoning. So, think about how to prevent the poisoning. Very young children put things in their mouths as a part of learning and exploring. They want to get the taste of the foods, of the things they find near there, which can lead to different health hazards related to those uh, food items. One of them is the poisoning. The highest incidence is between age 1 to 4 because whatever the child sees the stuff around him or her, the child wants to eat that. Thinks that it is safety, but the child does not have that ability to make a judgment whether that is harmful for the health or good for the health. That's why this poisoning, it also causes include eating substances such as aspirin, cigarette butts, vitamin pills. Again, those medications and such as aspirins and the cigarette, if the parent has the habit of smoking, the child play with the cigarette butt, and certain vitamin pills might be there on the table. The kid comes and begins to eat that. Drugs and household product. These are the major areas of poisoning, possibility of poisoning a kid. So as a support worker, we have to prevent the children from poisoning those things. Think about safety box ways to prevent accidental poisoning, page number 359. Let's go to page number 359. So there are couple of points given there. We have to be mindful of that. Read the label on all the household product before buying them and try to use them at less toxic one. Every household may have to buy certain solution to clean the house, bathroom, and all other areas. So buy certain less toxic substance. All medications are harmful if it is taken by unwanted person. In the case of children, children are always putting themselves in the risk by taking medication which they do not know. Do not believe or do not rely on the child container lid of a pot, of a box, because they can open it anyway. There are so many ways. They are very imaginative. They can figure out how to open, and they can harm themselves. Therefore, another way to prevent the poisoning could be putting the medication and hazardous, the fire, the lighter, the cigarette, and all other things away from the children. All the box of medication there is written, keep the medication away from the children. Do not encourage the kids to taste the medication as something sweet. Otherwise, they will take the medication as something sweet and they will be in trouble. So there are many other ways they can get poisoning by that. Household cleaning product and different cosmetics. People put the different cosmetic on the dressing table. We have to prevent the children from those things because they could cause the poisoning. Reye syndrome. This Reye syndrome is a fatal disease, fatal accident. It's a condition, it's a syndrome, and it's a condition of the inflammation of brain. Researcher has linked the use of ASA, aspirin or acetyl salicylic acid taken for the flu or chickenpox symptoms with the development of Reye syndrome, a condition with the development of Reye syndrome. These aspirin are very fatal medication given for certain condition, but if there is a misuse of these medication, it could lead to the inflammation of the brain. A rare but often fatal condition can occur during the recovery stage of flu or chickenpox. Do not give ASA to children, means aspirin. Do not give ASA to children, always consult the physician. Instead of aspirin, you can give acetaminophen or Tylenol when they have a fever, when they have a body ache, or when there is a prescription to give them. You can ask with the family member or you can ask with the supervisor for that. Now the discipline. Our role as a personal support worker may not be just policing the children. We don't have to play our role as a police official. We are not there to discipline them. We are there to give them safety, assist them in feeding, and other things. Protecting the injuries, fall, poisoning, drowning, etc. Know the rules of the acceptable behavior in each family situation. What are the behavior patterns that has been practiced in that family? Know about it. Ask an appropriate family member to clarify the rules if you are unsure about it. If you need to know more about the rules of the family, ask one of the family member which is appropriate. And reinforce existing rules. Means you comply with those rules, follow those rules. Try to encourage the kid to follow those rules. And in your behavior, you have to follow the rules, but you try to reinforce the rules to the kid, but in a soft manner, very, very polite manner. Be consistent when using discipline, because there is a chance of child abuse while people are using the teaching about the discipline or reinforcing the rules and teaching child the discipline. There are so many causes of child abuse. Praise the child's effort to follow the rules. It means positive enforcement. Give the positively enforce, encourage the child positively. Make the child um, very strong. Give them some strong support so that the child can take it positively and praise it. Punishing a child is not your responsibility. So, this is the main point. You have to follow the family rule. You have to follow the family discipline. You can reinforce the existing rule to the child, but you have to reinforce the rule in positive way. You cannot punish a child, and it is not your business. The moment you punish the child, it is considered abuse, and any kind of abuse, verbal abuse, psychological abuse, physical abuse, sexual abuse, all abuse are equally questionable, and these are the legal issue, and you are in trouble. Now we are discussing about supporting the challenging child. The child may be challenging. Imagine, how can a child be a challenging? It is the physical condition. It is the mental health, sometimes it is a neurological condition, sometimes it is a physical condition, their birth defect and all other things. Children of all ages express their feelings of anger, frustration, fear, guilt, or shame. The main causes of these include too many changes in their lives, painful losses, problems at school. Here, we have to know that children are normal human beings. They have feelings of anger, frustration, fear, guilt, or shame. So we have to protect the children from all these negative aspects. All these, we don't have to blow those negative air to the child. we have to we don't have to show our angerness which they can learn how to be anger. We don't have to show the frustration, because our showing pattern, they will copy it. We don't have to threaten. Threatening gives them fear, and fear is a psychological condition. And guilt, when we humiliate if we humiliate a child, they feel guilt. Even if they have made some error, we have to encourage them positively, and we have to encourage them, we have to keep their self-esteem high by positive reinforcement. So, because of the different changes in their lives, sometimes the parents divorce, sometimes they move from one place to another, sometimes they go to the place they don't like, or they leave the place they love, and painful losses. Sometimes one of the parent dies or divorce, and most of the time, certain hyperactivity, the children with the hyperactivities, they might have a problem in the school. They are not doing the homework in time. That's why they have to be, we have to be very careful while dealing with these children. Support worker provide care in a non-judgmental and supportive manner. Remember, our duty is not to threaten, not to uh, not to reinforce unnecessarily. Our our job is not to threaten or challenge or cause the fear and frustration, but to be non-judgmental way. We should not stereotype a child. We should not say that the child at this age will be yelling at all the time. This is a wrong idea. We should be mindful that there may be certain underlying pattern of those behavior. We have to figure out the root cause of those behavior. To figure out that behavior, and showing the non-judgmental and supporting manner, we have to go to box number 20.4, 12 principle of supporting a challenging child. So, what are those 12 points, 12 principles? Principle number 1, we have to be specific about this expectation and stick with them. What is their expectation? We have to focus on that. Number two, put things first thing first. Keep your focus on important issues and choose your battles wisely. And teach the person, encourage the person for making good decision of that. This is how we can support the challenging kid. Praise, and praise some more. This is called positive reinforcement. Positively reinforce the child, support the child, encourage the child. It makes their self-esteem high, and positive self-esteem, it improves their behavior. Number four, the number four, try to have the knowledge about child's specific problem and difficult situation. What is the major cause of the challenging behavior? Try to figure out about that. And as usual, always follow the care plan of the child. Teach the child about the specific negative and positive consequences of the behavior, and teach them about, show them about, remind them about the rewards and punishment of those behavior. Do the action very quickly and speak calmly, not in a violent manner. Never yell at the children. Similarly, give some bonuses, some compensation, and encourage the person to focus on positive way. For example, if a child puts his clothes away, reward him by placing a good star on his activities sheet. Display the sheet where other people can see it. This is how you can encourage the person. And this is how you can be non-judgmental and supportive. Similarly, practice forgiveness. The more you forgive the child, the more positively the child will understand you. And another principle could be, you can seek the help, take help from other people about how to give more supportive environment, how to give more supportive manner to the child. And at the same time, your prime duty is your own safety and your own care. You have to pay attention on yourself. All these ways are very, very important for caring the child with the non-judgmental way, and the child who has an issue of challenging behavior. Now, preventing infection. As we know that Canadian healthcare system, they have a different rules and guidelines of giving so many injection vaccines of the children of their different ages. The children's immune system are still developing. They are given certain immune boosting vaccines. Resistance to infection develops only after exposure to a multitude of germs. In the children going to the daycare and home care settings, they have multitude of infections and germs. And to prevent, to give the resistance to those infections, those immune system related medications are administered. It's not your duty to administer those medication, but to know about it, remind the parents about it, talk with the supervisor about it. Large groups are breeding grounds. When there are germs and bacteria or pathogen, try to minimize them. The carbs should be minimized, and because the bacteria, there is a large presence and it becomes the breeding grounds. It multiplies. So those vaccines prevent those multiplications. Children with physical or developmental delays may be prone to infectious disease. They have remind the parent about their health card, their vaccine, the forms, that their age-related vaccines and medications, and their family doctor, and timely visiting the family doctor, prescribe medication and giving all these medication in timely manner. All these come under the duty of personal support worker. So, similarly, proper hand and hygiene practice are most important. Proper hand washing, and it is your duty, it is our duty or your duty as a support worker to teach the child about how to do the proper hand washing. So, how to put the soap. It's not good to teach them about using the bar soap, rather, certain liquid soap putting in the hand as we practice in our course the hand washing. In the same manner, we have to teach them lathering for rigorous lathering the hand for 20 second to 25 second, and cleaning the hand in the running water and making the hand dry. All these are the basic principle of proper hand washing should be taught to them. Similarly, single most important things anyone can do to prevent the illness is wash hand thoroughly and frequently. It is said that every half an hour we have to encourage the children and ourselves, we have to wash or clean the hands by using the um, alcohol based hand sanitizer, because it prevents the spread of bacteria from one person to another person. Soap and warm water for 15 seconds, about as long as it takes to sing the happy birthday song twice. This is the best way to teach the children. So let the children sing the song Happy Birthday twice. Until that time, they are just rubbing the hand together with the soap, and they wash the hand. This is how we positively reinforce the child. Alcohol based hand sanitizer can also be used. In the certain situation when we do not have the soap and water and hand washing basin, we can also use the hand sanitizer. But be careful while using the alcohol based hand sanitizer, because they can break the skin, the soft skin of the children. Keeping child home from school. So, what you understand by keeping child home from school? Children should not go to school if the child has a strep throat, it means sore throat, certain uneasy throat, or bacterial conjunctivitis. It is an inflammation of conjunctiva and is recommended to be an antibiotic therapy for 24 hours before returning to the school. When a child is sick, whatever is the reason of that, either be conjunctivitis or any kind of bacterial infection or any strep throat or ear infection, which is the most common infection to the children because of the exposure to the external things, external pathogens in the playground area. Our prime duty is to remind the family and to act accordingly for not sending 24 hours before after the application of those antibiotic uh, therapy. If the kid has a fever more than 38 degrees Celsius, or if the kid is vomiting or has a diarrhea, if the kid has just rashes in the body, or whatever is the reason, we have to keep the kid at home, and we cannot send the kid to the school, and we have to inform the school for that reason. And your role at this point to be connecting all the people, like you have to inform the supervisor, You have to tell the family to talk to the school, and you have to let the family members know that your kid has this condition, and you have to take care of the kids. Why children miss school? There are multiple reasons about for this question. Why children miss school? There are so many reasons. Upper respiratory infection, URIs, or cold, different flus in the flu season. Because of the flu season, they have a upper respiratory tract infection, more severe and longer lasting symptom than adults. They have a chronically up to, it does not go for 2 to 3 weeks. If it is a viral, generally 2 weeks is the recommended time that we have to protect the children from those infection. And there may be another type of flu, gastroenteritis. It's the stomach flu. It's a dehydration related. Sometimes they don't drink enough water. Concern with the dehydration, not drinking enough water means dehydration means not drinking enough water, and because of the insufficient water, they have this problem. Another, should drink an oral rehydration solution, Pedialyte. So this is Pedialyte is the most common solution given to the children who do not drink enough water. Because of the Pedialyte, it causes rehydration. It is an oral solution. It is a solution mixed with the water or without water, as recommended by the physician. We have to encourage the child to drink this solution. Ear infection, otitis media, cold or allergies cause congestion and fluid gets trapped in the middle ear, and middle ear does not function properly because it is the place where the eardrum vibrates and receives the sound. Because of the infection, child has a problem in hearing also. And pink eyes conjunctivitis. This is an eyes problem. Sometimes, most commonly, the children in the small school, kindergarten or daycare children, highly contagious. This is the worst aspect of this conjunctivitis. It is contagious. It can be transmitted from one person to another person very easily. White part of the eye become inflamed, red, itchy, often with the discharge. Requires antibiotic eye drops or ointment creams. So your duty is to let the family member know and to let the supervisor know that the eye of the kid is very, very pink and inflamed, and you have to let the people know in time so that they can bring the medication and they can administer the medication in time. Strep throat. It is also called the sore throat, and it is a bacterial infection. Sore throat caused by Streptococcus bacterium. It's a group of bacteria. That's why it's called bacterium. Painful swallowing, requires antibiotics. If felt untreated, can lead to rheumatoid fever and damage to the heart valves. Remember, this bacterial infection is Streptococcus bacterium. The varieties of the bacteria, this group of bacteria, they causes the sore throat, and sore throat are not not something to be neglected. It causes very painful swallowing. Person cannot swallow the food, requires antibiotics. It is bacterial infection, and therefore every bacterial infection needs antibiotics, and it should be treated. Untreated could lead to fatal disease. Now it is a time of vaccination. All the age-related vaccinations are there, and Public Health of Canada has recommended so many vaccination depending on the different age factors of the children. So, as a support worker, our prime duty is to remind the family members and to discuss it about the supervisor about the health card and the vaccine, the yellow vaccine form. Canadian babies and children require various vaccination. Visit Health Canada for updated immunization and schedules. You have to remind the family the schedule of the immunization. Effect of not vaccinating can be pneumonia. This is very fatal disease. Pneumonia can take the life. Deafness, it's ear problem, brain damage, heart problem, blindness, and paralysis. These are life-threatening diseases or condition that might be there because of the lack of updated immunization. Therefore, our role as a personal support worker is to gather the information, to record the information, to remind the people and to discuss about it because the children's life is as precious as our life. Risk of not being vaccinated is much greater than risk of vaccination itself. These are the major issues of taking the advantage of getting vaccine or not. Maybe these are the duty of a nurse or a doctor. They will be focusing it more. But our duty as a support worker is to remind the family members and the supervisor. And thank you